Your children with diabetes. Your children will learn how to live with type 2 diabetes and stabilize their blood sugar levels. The outline of this presentation is personal introduction, learning objectives, type 2 diabetes, diabetes management, statistics among adolescents and diabetes, the characteristics of adolescents and diabetes, nutrition education for your child. We'll have a 5-minute break. Plan for adolescents and diabetes, nutrition topic, effective health change, what are healthy defaults? Healthy defaults for adolescents, healthy eating suggestions for adolescents, physical activity importance, 70 minutes of activities and participation, questions and answers, and then references. My name is Deborah McWilliams. I am an MSA candidate and my expected graduation date from University of New England is March of 2019. I have a master's degree in health psychology from North Central University. I have a bachelor's degree in allied health science from Southern New Hampshire University. The learning objectives is to describe the difference between prediabetes, type 1 diabetes, and type 2 diabetes. Discussing the importance of self-monitoring glucose levels twice daily. Discern the health benefits of controlling blood sugar and having a healthier lifestyle. Describe the importance of conducting a food diary of daily foods that are consumed. Prediabetes, type 1 and type 2 diabetes. Prediabetes occurs when blood sugar glucose levels are higher than normal. Prediabetes is diagnosed based on specific criteria, like impaired fasting plasma glucose, impaired glucose tolerance, a fasting glucose from 100 to 125 mgs. Type 1 diabetes is most common metabolic diseases in many countries. Many children are diagnosed with type 1 diabetes almost daily, and blood tests are required for a diagnosis. Type 1 diabetes develops when the body's immune system destroys pancreatic beta cells. Administer injections of insulin by syringes or insulin pump. Most times your children would have to administer insulin through a syringe or insulin pump. Type 2 diabetes is a chronic progressive disease with high morbidity and mortality rate. It affects the way the body processes sugar, glucose. Type 2 diabetes begins as insulin resistance. The symptoms with type 2 diabetes is almost as similar to type 1 diabetes. You can urinate very often, you will feel very thirsty, you'll have extreme fatigue, blurry vision, weight loss, tingling, pain, and numbness, which can be in your hands, your fingers, your feet, your legs. Just depends on how severe your condition is. Having diabetes, of course, can bring some health risks. The complications can be cardiovascular issues, which is heart and blood vessel disease. You can have kidney disease, skin, foot, and eye problems, sometimes cataracts in your eyes, diabetic eye. You can also have probably some nerve damage, and that's a factor from tingling and numbness and pain as well. So, what is diabetes management? Well, your children would need regular physical activity. They would need to get enough sleep and keep stress at a minimum. You and your child will need to develop a healthy eating and activity plan. You and your child can recognize any of the symptoms and signs of high or low blood sugar. By monitoring your child's blood sugar daily, you can recognize any signs of high blood sugar or low blood sugar. Monitor any new problems early. If there's new problems that occur, let your doctor know so that they would be aware of what to be able to do to help. Take insulin appropriately if needed. Type 1 diabetes, normally you have to take insulin automatically, but if you have type 2 and your doctor says, well, you need insulin, well, you would know how to take it appropriately through help. They would need to monitor glucose levels daily. By monitoring them daily, you're able to see any foods that are hindering the blood glucose levels to raise. What is it? Is your nutrition change getting better over time? And so forth. There will be separate handouts from the American Diabetes Association that will be given to take home for reference. One is which factors affect blood glucose. Another is taking care of type 2 diabetes. And lastly, checking blood glucose. Those references, handouts will be helpful at home so you won't have to be confused about what am I doing wrong, what should I be doing, so forth. Characteristics among adolescents and diabetes. In the US, there are approximately 84 million Americans. That is 1 out of every 3 have prediabetes. About 90% of them don't even know that they have it. And most times you don't because prediabetes don't bring on any symptoms. About 5% of children have type 1 diabetes, and most times those children are born with it because their mom had gestational diabetes, or it could be genetic. More than 30 million Americans have diabetes, which is about 90 to 95% that have type 2 diabetes. The prevalence rates for adolescents 10 to 19 years old, about 18 per 100,000 for non-Hispanic white, 46 for Hispanic white, 108 African Americans, and 105 for U.S. Navajo Indians. In the United States, African Americans, Hispanic Americans, American Indians, and other ethnicities are at high risk for developing type 2 diabetes. That is higher of a rate than it is per non-Hispanic white Americans. The statistics of adolescents and diabetes. As you can see here, the annual incidence of diabetes in U.S. children and adolescents less than 10 years old. We have a high prevalence of type 1 among the non-Hispanic white. And that is given because those children probably were born with it or with genetics or from their mom. Children and adolescents between 10 and 19 years old, type 2 got higher because they got older and they probably didn't know that they were going to have it. They were probably just pre-diabetic and didn't know that they were, and it just developed into type 2 diabetes. But for non-Hispanic black, that rate went higher than it did for any other ethnicity. So we're looking at here about 45,000, 450,000 per year. That's what it says. The next one is a projected prevalence of diabetes in the United States. We all know from 1990 to now of undiagnosed and diagnosed people. As the years go higher, the rate among people and children are more getting undiagnosed than diagnosed. So let's see, for 2020 we have for undiagnosed about 35, 40 million to 50 million of not being diagnosed that they have diabetes. For 2020, for diagnosed people, it's of course from 0 or 1 to about 40 million people. And as you see here, 2030, it gets higher. 2040, it gets higher. 2050, it gets higher. And as years go by, that diagnosis of having diabetes is going to get higher. and the undiagnosis is going to get higher as well. All right, so what foods can lead to trouble? As you can see, foods that are high in fat, sugar, and salt, consuming fast foods, candy, cookies, cakes, ice cream, any sugar sweetened beverages that is like high sugary teas, the sodas, the energy drinks, the Gatorades, anything of those nature. Breads, pasta dishes, starchy foods. We have cereals, unless they are like Cheerios that are really good for the sugar. Burgers, the greasy, full fat burger that is just there. It's in your face and it's nasty. Full fat milk, like whole milk and sometimes 2%, can lead to trouble. Snack foods, like you have your pizza, your mac and cheese, your granola bars that are high in sugar, your chips, your crackers that aren't really that good. Your nuts are good. Popcorn. Sometimes popcorn is okay, but not always, depending on what flavor or how it's made. If it's air popped, it's fine. If it's microwave, sometimes it's not fine. Nutrition education for your child. They would need to consume foods that are heart healthy fats, like nuts, seeds, healthy oils, like coconut and olive. Carbohydrate counting. That involves keeping track of the amount of carbohydrates consumed daily, like limiting breads, pastas, and starchy foods. Carb counting is you have a set amount of carbohydrates that you have to consume daily, and you have to pick foods that are low in carbs to account for your daily carbs. So like if you're 30 milligrams, you need to have foods throughout the day that equal up to 30 milligrams or less than 30 milligrams. If needed, they should work with a registered dietitian on medical nutrition therapy to create personal eating plans based on their needs and likes. Sometimes you can think you can meal plan yourself, but you need that extra help to understand it more to figure out what's best. As you can see here, we have struggling to fill your plate with blood sugar friendly foods. So you're going to skip the starchy and processed foods and opt for the healthy choices on the right. So in the red, you need to avoid as many things as like your potatoes, peas, corn, lemonade, your regular sodas, sugar sweetened teas, sausages, bacon, fried meats, bananas, melons, those things you should avoid. But you should enjoy your berries, your sugar free foods, your greens, carrots, zucchini, sweet potatoes, things that are really good. Protein. You can have seafood, turkey, chicken, lean beef, soy products, beans, some dairy foods. Those are things that you should consume to help with your blood sugar, and sometimes eating those every day can help manage your diabetes. Achieving a balance between food intake, metabolic requirement, energy expenditure, and insulin action to attain glycemic control. By balancing your food intake, your metabolic control blood glucose, your energy levels, and insulin can help keep your glycemic control maintained. It's like that. Plan for adolescents and diabetes. Incorporating a healthy, balanced diet to help manage their health status. Therapeutic goal for adolescents with diabetes is before breakfast, glucose level should be between 90 to 130 milligrams. Before bed, 90 to 150 milligrams. Target your HbA1c less than 7%, glycated hemoglobin, and also your cholesterol and your glucose level as well. Target your blood pressure.